Asked about the possibility of the upsurge in COVID-19 cases and deaths being fueled by the emergence of a COVID-19 variant, which is said to be highly transmissible, Minister of Health Dr. Frank Anthony, in a bid to avoid speculation, drew reference to the negative results derived from the Caribbean Public Health Agency in Trinidad and Tobago some 2 months ago after 10 local patient samples were sent there for testing. CARFA had found that no other variations of the virus except SARS-CoV-2 is present in Guyana.
We don't have any, from the 10 samples that we have sent to CARFA, any indication that any such variant is circulating. But we'll have to send more samples and do the sequencing to be able to identify whether or not they're variants.
Since January, no other samples have been sent overseas to be tested for the COVID-19 variants. Dr. Anthony had indicated 2 months ago, after the first set of samples were sent to CARFA, that the agency had initiated an arrangement with Guyana to have the samples shipped on a monthly basis. However, on Tuesday, he disclosed that the arrangement was interrupted shortly after.
After that, for a little while, they had suspended the genetic sequencing at CARFA, or whatever relationship CARFA had with the laboratories that were doing the sequencing. So we weren't able to send back anything more to CARFA.
In addition, the ministry says it is still pursuing an arrangement with the Icahn School of Medicine in New York as a second source to conduct gene sequencing on local samples to identify new COVID-19 variants. Earlier this month, the subject minister announced that 180 patient samples will be sent to New York to undergo testing for the new variants. In January, the Eureka Medical Laboratory revealed to Nightly News that several patient samples collected to be tested for COVID-19 were missing a third gene. This abnormality presumably indicated that the patients were infected with one of the COVID-19 variants that had surfaced in Brazil, the United Kingdom, and South Africa. Eureka Medical Laboratory said it could not confirm which of the variants it was, since the laboratory does not have the capacity to conduct an analysis of the genes. Shortly after that disclosure, Dr. Anthony dismissed claims which were made by the laboratory, citing that there is no local laboratory that can conduct the requisite assessment needed to conclusively identify the variants. Meanwhile, neighboring Brazil is experiencing a frightening situation with the P1 COVID-19 variant, which continues to annihilate its healthcare system. Recently, Brazilians with their knees planted in the streets called on God to deliver their country from the COVID-19 pandemic that is killing thousands of persons daily. Even though the official borders linking the country to Guyana have been closed and are reportedly being manned by the joint services, there are reports that Brazilians continue to enter Guyana illegally on a daily basis. Temika Rodney reporting for the HGP Nightly News.